Welcome to Maine Concerns, where our news team gives you a closer look at the events that happened around Maine this week.
Good morning. Thanks for joining us. I'm your host, Cindy Campbell. We start off today talking about the Ronald McDonald House Charities of Maine, and specifically the houses themselves. Whitney Linscott, house manager for the Bangor Ronald McDonald House, tells us more about how the program works, including some surprising information about who's eligible to stay there. When you say Ronald McDonald House, it sounds like a place where you go to get a burger. Obviously, that's not what it is. Whitney, tell me, what is a Ronald McDonald House?
Yes, the Ronald McDonald House is a place, we call it a home away from home, for families of pediatric patients. We have a lot of people in Maine and all around the country and the world that travel for their child's medical care. So rather than them having to pay for a hotel and meals or have to travel back and forth home after these long appointments or hospitalizations, families can stay with us. So we're kind of like a mix between a house and a hotel. So families have their own private space, but then they also have some of those accommodations of home, some common areas like a kitchen and a laundry room and a playroom, so families can really spread out and enjoy their stay, but still be really conveniently located to the hospital.
I read some reviews on your website, and I think the one that struck me was the woman who said, you don't have to think about anything, you can just relax. And that must be so true, because something as simple as, it's 11 o'clock at night and I'm hungry, but I don't feel like running out to a restaurant, Ronald McDonald House can help with that.
Exactly. Well, and that's so good to hear. I hadn't read that review, so that's wonderful. That's exactly what we're going for. We don't want them to worry about anything, let alone paying for a hotel or paying for a room, but just what they have to find to eat or getting coffee or doing their laundry. There's so many factors that people forget when you're away from home. Usually you're away from home for a good reason. You know, you're on vacation or doing something fun, but this is such a stressful and challenging time for families. So we want to take away all of those worries as much as we can so the families can really focus their time and their energy on their child's care.
Now, is there a cost for staying at the Ronald McDonald House?
No, they're able to stay here for free. They're welcome to make a donation if they want to, but they're under no obligation to. And any family, as long as they meet our other eligibility criteria, they can stay with us. We don't have a financial component to that eligibility criteria because we're just a supportive environment. We want anyone to be able to stay here and save on costs and all those other worries if they need to.
I think that's an important word that you just said, too, is supportive, because if you're staying at a Ronald McDonald House while you have a child at the hospital who's sick, you're potentially staying with other families who are in similar situations, so there must be some camaraderie there.
Yes, we do see a lot of people build peer relationships because they're going through very similar circumstances. Even if it's a different medical condition or the same one, they're still having those same emotional experiences and those same stresses. So they rely on one another, but then we also have volunteers with caring and compassionate staff and volunteers here around the clock, and we're open 24/7, 365 days a year. So somebody's always here if you need somebody to talk to and just need to vent or ask some questions. There's always somebody available, and we try to get just lots of volunteers who really want to offer that support. Many of our volunteers and staff have been through similar experiences and can kind of understand some of what these families may be going through and how to offer that support for them.
Yeah, that's awesome. You're renovating some of your rooms right now, right?
Yes, we are. We're really excited to be doing that. So the house opened in 1983. So we've, every couple of years try to make sure we're renovating and updating and to keep the house really fresh and in great shape for our families. So lighting is kind of our newest project. We wanted brighter overhead lighting in the rooms, and our electrician has helped us to do that. And then kind of making it just feel more home-like, so getting a cozy chair inside of every room and some newer, more modern decor, just making it feel more homey and, accommodating for those families.
Right. Now, there are 2 Ronald McDonald Houses in Maine, correct?
Yes. So we have our house here in Bangor as well as a house in Portland.
And they're both very accessible to the hospital.
Yes, very accessible. We're both less than a mile, I would say maybe even less than half a mile from each of the local main hospitals for pediatric care.
So how does it work? I mean, if you're staying in a hotel, you go online and make a reservation. How does someone reserve a spot at a Ronald McDonald House?
Sure. So they have to check in with either their social worker or their nurse or anyone from their medical facility who can then make a referral for them to stay with us. And if they have any questions during that process or need any assistance, they can give us a call.
Okay. Now, I also wanted to mention there is a Ronald McDonald room at the hospital, right? What is that?
Sure. So we have a room at our hospital here in Bangor at Eastern Maine Medical Center, and then one at our hospital in Portland as well, Maine Medical Center. And the rooms are just a nice getaway for families. A lot of the families that are staying right on the pediatric floor often stay there right with their child. They don't want to miss the doctors coming in. They don't want to leave their child there alone sometimes. So sometimes one parent will stay here with the other kids in the family, and one family member will stay right at the hospital with a child that is the patient.
Right.
So we have a room right on that floor. So it's only for the pediatric floor and the PICU. Those families, when they need a break, they can go to this room, and it's not your typical waiting room. We wanted it to feel like you stepped out of the hospital and you got a break. However, you're just right there. So if something happens to your child, you're just steps away from them. The room here in Bangor has a full kitchen. We stock the pantry with snacks and coffee and eggs and some things that people can just go in and have a quick snack or make a whole meal. They can store their food in there. There's a little sitting area and dining area so they can watch TV. They could read a book, have a meal in there. And there's also a washer and dryer. So they don't have to go home or go find a laundromat. They can just take a few steps down the hall and really have a total break. Because we're not far from the hospital, but in those instances, if a young child is hospitalized, those families just don't want to leave their side at all. So we wanted to offer that program for them, and then we see more of the families that are staying much longer term in other departments, sometimes those departments, but, you know, kind of a combination of other departments as well as theirs.
Right. That's got to be so nice for them, because the stress that you have with a child who's in the hospital, and to be able to step away and kind of get out of the clinical atmosphere. Mm-hmm. So before we wrap this up, I wanted to mention that on your website, you have a wish list through Amazon, right? So that's a great way people could contribute.
Yeah, there's so many ways that people can get involved with our organization. And we run on a really small team of staff throughout the whole state to cover both of our family rooms and our houses. We have 10 full-time staff. So we truly rely on the support of volunteers and the community that helps us so much. So I'm fortunate in the way that I don't have to purchase a lot of cleaning supplies and snacks and coffee and things for the house, because our community is so generous in donating those items. So each month we do an inventory of the houses, and we come up with a wish list for each house of the things that we're running low on, whether it's household items like pillowcases or food and drinks like coffee, and just snack items. It's great to have coffee and snacks for families to enjoy here and take with them to the hospital. And then we have a wonderful volunteer program where people can be those supportive individuals that can come help out at the house and help us check in new families and help them get oriented and offer them support while they're here, help us keep the house really clean and restocked for them. And then we have a meal program as well. So we have people that come in and cook meals for the families. So again, that's one more thing they don't have to worry about, is coming back here and making dinner either for themselves or their whole family. The meals are free. The volunteers provide the food and make everything right here for them so they can come back. And there's a homemade lasagna or a pizza night, whatever it might be.
And I'm sure there's information about all of this on your website. What's your website?
Yes. So rmhcmaine.org is our website, and we have lots of information about all of our programs and pictures of those, as well as virtual house tour of the Bangor House. And then we have all of our volunteer roles listed there, as well as the wish list and other fundraisers and ways you can get involved.
Okay, awesome. And to help people remember RMHC, it's Ronald McDonald House Charities is what that stands for.
Yes.
Okay. Whitney, that's what I had. Did we miss anything? Anything you want to add?
I think The only thing I wanted to add was just that we want to make sure that the families know that we're available, and it's not just for hospitalized children. So if people have regular appointments or just occasional appointments in the Bangor area or the Portland area, as well as mental health care and residential care. So if a child is at a local residential program or going to Acadia Hospital or Spring Harbor, their family is able to stay with us while they're transitioning their child or while they're visiting them as well.
That's wonderful. I didn't realize that. That's great information.
Yeah.
Find more information in that constantly updated Amazon wish list at rmhcmaine.org.